Hey guys, it's Dr. Emer, and we have one of those nights where we're going to treat a bunch of patients and staff so we can teach you all about fillers. And today we're going to use the Galderma family of fillers, and today we're going to work on one of our beautiful male patients and coordinators, John, who's already done some contouring of his chin and jaw. We already had 3 patients today that came in because they saw what John had done and they wanted that done. He's had his lateral part of his jawline, his chin, and he hasn't done his temple yet, and we're going to work on that area to contour and shape him because he's a very fit, athletic young male, and you start to lose volume in that area as we age, but if you metabolize very quickly, you can lose volume there too. So you can see right in here, he has a little bit of volume loss, and what that does is it contributes to lowering the brow and also not having an overall upper facial balance. And make sure you guys tell me what people are saying if they're commenting and things like that. So we're going to work first by improving that area. And there's a couple ways to do it. The first way is we're just going to go directly into the temple itself, all the way down to the bone. We're going to feel the bone, and we're just going to go right into that area. This is a very safe area to be injected. It doesn't have much blood vessel, but the thing is, it soaks up the filler. You got to use a lot of filler here to get a really good result.
And what filler are you using?
Today we're going to use Restylane Define, which has a nice particle size and has a nice lifting capacity. So you can see here, look at this, already starting to fill. Already starting to fill. We're working our way around the temple with my needle. We're working our way around the temple in various quadrants of the temple to fill it up. And then what we're going to do is the secret sauce. We're going to come right up at the top. And there's a little avascular area right here at the lateral edge of the brow. We're just going to go right in there, touch the bone, add just a little bit of filler there to get that lateral upper portion of the temple and also lift the brow. So now you can see just from that 2 insertion points, almost no bleeding, nice volumization with 1 syringe. We're going to go on to the second syringe. I'm actually going to use this needle.
Okay.
You're going to hold pressure there. You can see already, take a look at the difference. One side to the other, a little bit of lifting in the brow, a little nice, less hollowing. And it's good because we don't want to do large volume. This isn't something where we want someone to look like a bubble head, okay? We want them to look subtle and natural. So we're gonna, again, same thing, go right into the depth of that trough, all the way down, no massaging, just straight pressure. You guys know that, no massaging. When you do proper injections, there should be no reason to massage because it's in place. So we're going in, or again, deep trough, very safe area, filling that up. You can see that it's lifting. Okay, then once we start to see that elevation, then move to the different quadrants. It's gonna be a nice overall balance for him. Nothing that anyone would really notice was done, just better. It's just improved. A little posterior. Again, very safe area when you're on the bone. Okay. Then we're going to go again to that upper area, right at the edge of the brow, and go right in there along the bone. Give a nice little lift to there. And push the filler.
What is your opinion of Sculptra for temples in lieu of HA fillers?
I like to use both actually, and you can combine both together. Now take a look, let's show them. So without any massaging, you can take a look, no bruising, walks out of here like nothing was done. Temples look great, they're contoured, no more hollowing, a little lift in the temple. It's beautiful, it's perfect. I'm gonna hold right here, a little pressure with your left hand, good. Now we're gonna work on his chin because we wanna create overall balance between the lifting he has in his cheek, the elevation and the projection he has in his jawline, and now we wanna give him that bold look. So he wants that masculine, bold look. You can see a nice square appearance. So what we're going to do is we're going to focus right in the central area there, right along the bone, and we're just going to give him a nice definition here. Now, we don't want a Jay Leno chin, because he's not Jay Leno. Jay Leno is the only one that can pull that off. So we're going to focus on nice squaring off. And we're keeping it within the area of his lateral crease of his lip. Turn to me. Great. We're working our way right along the bone. Keeping it again within the right crease.
Cindy's waving. She says hi.
We love you,
Or
Cindy. All right, now let's take a look at how that did, because I might only want to keep it at that and use the other syringe for the jaw in the back. I think that's great. It's bold, it's projected, turn to the side. I think that elevation is perfect because look, when you draw a line from the lip down, it should be right parallel to the projection of the chin. If we go any further, it's going to look a little overdone. So let's use this last syringe and let's build out the jaw, the lateral jaw, to balance out that beautiful chin. I think it looks great. So what we're going to do, bite down for everybody. You can see that nice projection. We're going to put our finger right here. We're going to go 90 degrees right onto the bone and just do a little bit of projection. Now watch what's going to happen. Watch that building out. Watch my finger. Watch that nice jawline just coming to life. Okay, above and below that 90-degree angle of the mandible, and look at that squared off look. It's perfect. Right there. Simple as that. Now, don't go trying this at home. There's structures here that you need to know how to inject near. Turn a little to the right. There you go. Let's show everybody that angle. We're going right along that bone. Giving a nice projection here. Take a look at that squared off look. Beautiful. So look at that now. That nice angle. I can put my finger right in there. That's defined it. It's projected it. Let's show him his new look. His enhanced look.
Let's see.
Is just enhanced and contoured. Nothing major.
Oh yeah, it looks perfect. That looks really
It's contoured. It's natural. Let's say what we did. We gave him that squared off boxy look. A little bit more of that bold chin with projection, and then we filled the temple so he doesn't feel as hollow because he's a metabolizer. Perfect.
That looks really
very
good.
masculine.
Thank you.
I love
yeah.
it. What do you think? Tell everybody what you think.
I love it.
What were you trying to achieve?
Definitely the temples. It just makes me, I think, look healthier and just a little bit more full, which I really wanted because, like we said, I was hollowing out here. And then just jawline wise, this looks fantastic. I love how you kept this square and everything and built on it. Looks really good. I'm very happy.
What were your expectations?
Well, I just wanted a little bit more projection here, and again, just keep this balanced because this was getting defined, but then I was noticing this more.
Perfect.
So now it's, I think, very blended. I'm super happy.
Squared off. It looks good. It's masculine, and nobody will ever know. He won't even have a bruise.
Boom.
All right. Thanks, guys. That's male facial contouring.